Welcome back to the channel. We're going to take a deep dive today on tummy tuck recovery. Why? Because patients ask me often, what should my expectations be for recovery after an abdominoplasty or tummy tuck? There's going to be some links in the bio for the different products that we describe, so you're able to find them all in one place. And it's really just gathered there so that you can get the things that we're talking about in this video. It's important that you understand a little bit about abdominoplasty recovery because at the end of the day, recovery is the most important part. Everyone wants a tummy tuck. They understand why they need it after children. The biggest fear in most patients is pain and the recovery process. So by demystifying that process, I can help guide you through what to expect from day 0 to 2 years out after your surgical procedure. So let's start off by talking first about what's going to happen before the surgery. Obviously, you're going to see your doctor. You're going to go through the process of discussing what you need and what you want. A physical exam helps us to identify what's going on the inside. Is there a small hernia around the belly button that we're going to need to deal with? How will that affect the recovery process? Is there great separation between the muscles? And will a larger diastasis repair necessitate a longer recovery process? Is there fat in certain areas that we want to go after that's going to change our plan for liposuction and or skin tightening? And what are the other procedures that we're going to couple with the abdominoplasty? Because those things each interact and each change the overall recovery process. So for the intents and purposes of this video, I'm going to say abdominoplasty with some sort of breast surgery. Because let's face it, most of the tummy tucks we do are on patients that are seeking a mommy makeover. They're adjusting the breast and the tummy at the same time. And I'd say that's true of most abdominoplasty surgeons, although I do have many patients that come for tummy tuck only. You can add on other procedures like arm surgery and thigh surgery, but each of those has its own recovery timeline, which we'll add on at a different point when we discuss those procedures. But let's focus on mommy makeover, tummy, and breast. So, after discussing what go into your abdominoplasty surgery and the different approaches and techniques, then you're going to go towards the day of surgery. On the morning of surgery, I sit in the pre-op area with the patients and address all these questions again. Then I mark the patients. We go over the very specifics about where we're going to be doing liposuction, where the hernia repairs are going to be, and where the incisions are going to be. And this is critical because when you're standing up during the marking, we can see how gravity is affecting your body. Let's face it, you want to look good standing up. You want to look good when you're walking around the pool in a bathing suit, when you're in evening dress at a gala, not when you're laying down, because very few people see you in the laying down flat position. And so when we mark you standing up, it's so we can take note of those subtle changes and how they're going to affect things when you're standing, when gravity's working on your body. So you're in the pre-op area, we're lifting up the tummy skin, we're seeing how that affects the skin below, and then marking where the panty line is so that we can ensure that the incisions lie within the correct area. We're also marking the fat and those areas and showing how they look when you're standing so that when we do liposuction, we can affect things, change the overall shape of the body. Next, you go to the operating room. And in the operating room, everything gets prepared. You're going to have an anesthesiologist, you're going to have a nursing team, and I'm going to be there with you the whole time, making sure that things are going well during the process. And this could be the case in any surgical procedure with your surgeon. Most surgeons are in the room when you're going to sleep. After surgery, when you wake up, you're in an area which is called a recovery area, which is right outside of the operating room. This is an area where nurses are going to be giving you some medication to help make you comfortable, help with nausea, other issues. The truth is, in my practice, I very rarely see nausea. Why? Well, because I'm pretty careful about what I do before surgery. I utilize a state-of-the-art medication called Amend, which is a medicine that's designed to prevent the nausea that can occur from anesthesia. Of course, we use other medications during anesthesia, which every anesthesiologist uses during their cases, and these affect nausea as well. But there's an even more important and deeper reason why patients of mine don't have nausea after, and that's because we use less opiates. We don't use the medications that are designed to treat pain while you're asleep. How can we do that? Well, it's related to my approach to pain, which we're going to go over in a bit. But if you use great pain medication during surgery, before the knife even touches the skin, then the anesthesiologist doesn't have to treat pain that they see when the patient is asleep. That means they get to use less of the opiates. That's why you're not nauseous when you wake up. So a multifaceted approach to pain is really what you want from your surgeon, and it definitely separates my practice from every other person's out there. Once you wake up in that after-care recovery area, you're going to feel tired and sleepy. And you're going to get medications again from those nurses to help prevent nausea, discomfort, etc. Then you're going to go to an aftercare facility. My practice, I require patients almost 100% of the time to go to aftercare, to have a nurse present. Why? Because you need somebody to be able to give you medications for sleep, nausea, and discomfort. Someone who can monitor you for potentially life-threatening or rare complications that could occur, like bleeding or other issues. The main reason you're there is so that I can come see you that night to check up on you to make sure that you're safe and you're comfortable. Because let's face it, it's a scary procedure. And you will remember when I see you that night. You will remember that conversation. That point in time, I'm going to go over all the things that we talked about during surgery. I'm going to show you some photos and tell you how things went on the inside and basically tell you what we did. Then you're going to feel a lot better. The next morning you wake up, you're still in the aftercare facility. The nurses can give you more medications. I come back and see patients the morning after just to check up on them and see how they're doing. After this process, we take down the garments, make sure there's no swelling, there's not any signs of acute bleeding or other issues. You're ready for the next phase. You're going to be going to a hyperbaric chamber. Why? Well, because when we elevate the skin from the blood supply, the first thing it does is cry out for oxygen. And it does that by secreting inflammatory factors. So if we give the skin the oxygen it needs, inflammation and swelling goes down, skin healing is better, and it helps eliminate the secondary metabolites of the anesthesia. So you feel more awake and more alert after the procedure. And this is key because let's face it, you don't want to be super groggy afterwards. So again, going back to the earlier discussion, less narcotics, no nausea, and hyperbaric makes it so that by day 2, most patients are awake, alert, and feeling much better. Day 3 to 5, you're up and about, you're walking around the house, you're getting small tasks done. You're not lifting anything really above 5 pounds. You don't want to be in bed. You want to be sitting upright. Now, we usually have a binder that we put on patients, and there will be a link to information on that. But we usually give them 2, so there's one to wash and one to wear, and same thing with the post-surgical bras. The other things that we recommend are ABDs. These are pads that go on the inside to absorb some fluid if it happens, and after liposuction there's always a little bit of that. And we use foam, surgical foam, which we call epifoam or post-liposuction foam. These things are all critical because the foam helps to prevent the binder from rubbing against the skin. Anywhere that you've had surgery with this kind of numbing medication, the skin remains numb. And if the skin is numb, then it can't really sense when the binder or the other garments are rubbing against it. We want to utilize the foam as a barrier between the skin and the binder so that it doesn't create a friction burn or what we call a faja burn after the surgical procedure. In the early postoperative phase, there may be other things that we recommend. In my practice, we utilize nutrition supplements before and after. One of them is called Heal Fast. It's basically a surgical supplement designed for surgery that helps to deal with swelling, bruising, and other things after, and to improve healing. We also use something called Juven. Juven is a product made by the same company that makes Ensure, and it's a post-surgical nutrition supplement that's a powder that you mix with water and drink 2 times a day. It has been clinically proven to improve wound healing after surgical procedures and in wound healing in general. So we combine these things in order to improve the overall healing process for patients. Because let's face it, in that first 3 to 5 days, you're not super hungry, you have a hard time eating because everything is tight and you feel full early on. We need to make sure you're getting the basic building blocks you need to heal. And there'll be some more information about those products here. Also, of course, you need a high protein diet and you need to be careful about your total caloric consumption because in this early phase, your body's burning a lot of calories just to heal what's going on the inside. So at the end of those 3 to 5 days being at home, you're feeling much better. You're in control again, you're starting to feel stronger, you're getting back to doing little things. Then at 1 week, you're back in my office. Why are you there at 7 days? Well, it's not really to take many stitches out. There's not really anything on the outside that needs to change. It's really just to see how you're doing on the inside. Because the truth is, at this point, although you're feeling a lot better from a surgical standpoint, you're at your lowest point emotionally. Not many surgeons talk about this, but this is what we basically call the low point. Why? Because you're withdrawing from narcotics, anesthesia, adrenaline, and cortisol. These are all critical factors that affect the way that you feel. They make you feel a sense of anxiety and depression. They make you question what you've done. They make you look in the mirror and say, oh my gosh, I look crazy. What was I thinking? And I'm going to tell you, this is totally normal. Feeling like this is a normal part of surgery, and it's a part of the withdrawal from those key elements. And once you get over that, at around day 10, you start to feel much better. So the main point of that 7-day visit is to check up on you emotionally and see how you're doing. 10 days out, you feel much better. You're over that emotional roller coaster. You're feeling more confident and more comfortable about your results. You're looking in the mirror. You're starting to see the changes that we note. 2 weeks out, you're back doing most of the things you were doing before. I clear patients for upright bike, Stairmaster, and elliptical trainer at low speeds. The more you walk, the better. Not only does it prevent blood clots, it also improves blood flow to the skin and it improves the lymphatic function of the areas that we've operated on. This reduces swelling and it helps to turn over the bruising and the other inflammatory components that are going on the inside. 2 weeks is also a time point when you've got a routine going. You started your faja garments, we're going to have information on that here, and you started a lymphatic massage. There's a big difference between post-surgical lymphatic and post-surgical liposuction massage, and you need to have a practitioner that knows what they're doing to help guide that process. But the truth is, you want to have massage after and you want to have compression after. Why do you ask? This is absolutely critical. Anytime there's swelling in the soft tissues, we call it lymphatic swelling. There's lymphatic fluid that builds up in the small lymphatic vessels. If that fluid stays put, over time it creates secondary inflammatory mediators or signals, and those create fibrosis or scar tissue on the inside. We know this from all the research that we've done on lymphedema surgery, and we know this from how the lymphatics can malfunction after breast cancer surgery or in genetic conditions. So we know that over time, lymphatic issue patients can develop scar tissue on the inside. We don't want that. So if we use compression, it squeezes the fluid out. If we do massage, it activates the lymphatics to move that fluid out. This helps to prevent fibrosis or scar tissue on the inside and makes sure that later on your results look as good as they can be. Different patients are at risk for lymphatic stasis, and we don't know who genetically is going to be at risk for fibrosis or scar tissue after. So all we can do is help to prevent it in all patients by doing compression and massage. Now, that's the 2-week kind of window and the critical concepts at that point. 3 weeks out, you're back at work, you're doing the things you were doing before. Everything is kind of changing, but you're still bruised, you're still swollen, and incisions are only about 70% healed. The sensation is changing. So your breasts feel like your breasts again, and your tummy feels like your tummy again. And this is very important because you start to feel more natural. You're getting a routine, the faja garments are working, everything is changing. You want to be careful not to use things that are going to dig into your incisions, and you're still using post-surgical bra and post-surgical garments like faja or binder. The truth is, if you have implants, this is when they start to drop and look good. Now, 4 weeks out, all the bruising is gone. Swelling is still coming and going, and we call this swell hell. What is swell hell? Well, you wake up in the morning, everything is flat, and then towards the end of the day, everything looks crazy. You look like the Michelin Man. What's happening? Your lymphatics are overwhelmed. They work well at night, but not well during the day. You add a little salt into the mix, or you have a little bit of alcohol, and everything blows right up. So this is a frustrating time because you feel like you want the best results and they're not coming quick enough. Everyone is impulsive after surgery. These are days when I get questions about the step off or the feeling like maybe there's a little shelf because fluid gets trapped right at the level of the incision, and so the upper part of the skin flap looks like it's sticking out more than the bottom. Hang tight. Over time, this gets better and better. 6 weeks out, all of the swelling is improved, all the bruising is basically gone, and the incisions are well healing. This is a time frame when I clear patients to jump in the ocean or the pool if everything's healed on the outside. This is a time point when you start to really enjoy the results. You're starting to go out more and show off your body. You're getting compliments and you're feeling much more confident about the shape of your body. It's also a time point when I start topical medications, which we'll talk about and list here. Some of these medications are prescription medications that I prescribe from a compounding pharmacy. They're designed to change the color by lightening the color or the pigment of the skin that's there, and they're also designed to change the shape of the scar to help it become much more flat over time. They involve the compounds including tranexamic acid, isotretinoin, and hydroquinone. And we use many other different compounds in conjunction with these to synergistically improve the effects. We may also utilize injectable medications to help reduce scar tissue, and we're going to adjust the overall shape of your compression garments. We may need to downsize or add in foam, like the EpiFoam we talked about before, to help continue to improve the compression over time. We also are going to want to use an insert in the belly button to reduce the risk that the belly button hole could tighten up and eventually close. That can happen over time if you aren't careful and you don't watch that scar tissue formation. 6 months, like I said, is a time point when you're starting to enjoy the results. But 3 months is when you're ready for high-def photography or for a wedding. That's when patients are sending me wine, flowers, and more patients. Why? Because that's when they look in the mirror and they say, I love my results. My body looks amazing. Everything's fully healed on the outside. And I'm going to tell you truthfully, you are 100% healed on the outside, but you're only about 50% healed on the inside. Massage here, let me do an injection. Let's do a laser to improve the quality of the upraised scars that are there. Or let's change further what's going on with other approaches, light-based technologies, radiofrequency microneedling, and topical medicines. And you're going to say, thank you, this is all great, this is all part of the process. 6 months, you're 60% healed on the inside. 1 year, 75 to 80% healed. And 2 years fully healed on the inside, meaning if someone looked inside, the signs of surgery would be gone. So it's not just surgery and see you later. It's not just surgery and goodbye. I follow my patients long term to ensure that the results look great, not just at 1 week out, 2 weeks out, 3 months out, but even up to 2 years so we can address things like upraised scars, color, etc., to really give you the best result out there. So This is the tummy tuck kind of recovery timeline from day 0 to 2 years out. And the truth is many things change and there are a lot of ups and downs. It is a surgical roller coaster. If you're not ready emotionally, don't do it. Take time, make sure that you are ready. If somebody's sick at home, difficulty at work, tough stuff with a loved one, not time for surgery because you need the gas in your tank to deal with the ups and downs. And it seems like it's going to be ups and downs for a short period, but it really is that first 3 months that are the most critical window to get the best results. So this has been the tummy tuck recovery timeline. There is far more that goes into it, and trust, every patient has a different experience. But this is a general outline giving you an idea of what to expect before, during, and after to have the best possible results.